Good evening and welcome to week 9, our final week in the PRI Breathing Mechanics in COVID Times webinar. We've heard some great feedback and we thank you guys for joining us again this week. This really was meant to be a series, so we appreciate all of you who have joined us on every week. We see some faces on here that I'm pretty sure have joined us on every week. Which is really exciting. And for those of you who maybe are just tuning in, we would recommend that you go back and try to catch up and try to watch them all in sequence, because I think tonight we will really pull things together in this final webinar that Ron has ready for you tonight. So I'm going to go ahead and turn it over to him, but thank you again, everyone, for joining us. And we are so thankful to hear that you guys are all appreciating this, and we're excited to have this as a resource for clinicians and patients and anyone who's wants to view this for many years to come.
Amen to that, and welcome and thank you. And again, I want to just compliment Jen one more time for recognizing that, you know, when we started this out, she goes, Ron, why don't we go 9 or 10 weeks? And I said, sure, why not? I think we have enough to talk about. We were just talking a few minutes before we started this, how much we both appreciated the opportunity you've given us, but how grateful we are for you joining us every evening like this. And we recognize some faces out there that have been with us for every week, and it means a lot to us. The feedback has been really good and wonderful. So I agree with her. If you are taking this for the first, second time, whatever, go back and try to follow the sequence of events that took place over the last 9 weeks. Boy, tonight's a special evening for me. I was telling Jen that I enjoyed putting this together from day one. This evening was prepared 9, 10 weeks ago. So I've been holding my breath for this, literally. Arm swing. The title of the course tonight is Arm Swing, and its influence on arterialization and airway opening. We have so much discussion going on in the world right now about how important it is to manage airways and how important it is to keep them open. You know, obviously, it's the last thing we want to do is close down on an airway. But the arm is often not looked at as an airway tool. It's not looked at as a instrument for our breathing sequential activity. I'm not sure really what the arm is looked at for. You know, you talk to one person who does a little bit of work with maybe ballet or dance, and you'll say you need an arm for balance. You talk to somebody who is a painter, you'll see you need an arm for a steady hand. You can go around and talk to a lot of people about arms and what they mean in your life. I don't think you're going to get a lot of responses. It's one of the most important things you have to utilize for breathing. I don't think you'll hear that. But I've been thinking about this for a number of months, maybe years. And tonight we're going to go over why I believe arm swing is as important as anything you do with an appendage. That would include your 2 mandibles you have. You want to have a ramus on one side and a ramus on the other, and you've got 2 legs, one on each side. But you also have 2 arms. And their connection is more than just an orthopedic connection. Their connection with the world around you and with the world within you is solid, as you'll find out this evening. So, and Jen, I'm clicking and...
There you go.
The effect of arm and body position on respiratory ventilation for pulmonary recovery after strenuous training is well described in the literature. You don't have to go very far. There are a number of articles that will tell you that by leaning forward and placing the hands on the knees leads to significantly greater ventilation compared with standing with arms at the sides and standing with the hands behind the head at rest. This just recently came out, the effects of 2 different recovery postures during high intensity interval training. It was an article available in the Journal of ACSM 2019. None of us are surprised that this and a number of other researchers out there doing research on ventilatory activity following high intense training is usually improved when you take your hands and put them on your knees, rest them on your knees, round your back out, get your body into thoracic genuflection, and sit there and breathe. And let your body expand and collapse, expand and collapse. Gravity will assist you with both. It'll help you expand and collapse. That's the best way to recover, is put your body in a thoracic flexed state. Now, we need to be mindful of that, because why not take the same principles that we use following a high intense workout and maintain that when we're actually going through the workout itself, versus waiting till we're done and get in that position and go down there and breathe. It would make sense that we actually put ourselves into a state where we maintain thoracic flexion during that intense workout, regardless of what it would be. And there are very few things that you'll do in life that will not allow you to work out at a high intense level without maintaining thoracic flexion. So keep that in mind. So our body was meant to work hard. It was meant to work hard with intensity that you put in through the thorax itself to maintain this flexed state. Our arms, however, are also very, very important in maximizing this perfusion that we started 9 weeks ago during exercise-induced increased ventilation. Exercise-induced increased ventilation. What does that mean? Our ventilatory system has to pick up. It has to start to become more powerful and efficient as we work out. And the more we work out with the higher levels of work demanded on us, the more we have to work on getting our perfusion up to match it. That respiratory perfusion is matched to the exercise-induced ventilatory system through your arms. Very little research exists regarding the position and swing of arms during forward locomotor movement. In fact, most articles on gait and forward locomotion don't even talk about arms, regardless of the body speed, the body elevation, or the ground elevation. So there's nothing on, you're not going to find a whole lot on how fast are you moving? Is your body being elevated, or is the ground being elevated? And what are your arms doing during that time of elevation or that speed? One of the best studies, and I think Jen included it in the information this evening. They got 2 handouts.
I did not post that yet, but I will post that to the website.
Okay.
These 2 articles, they are available free online, so you can search them within this, but I will include a link on the webinars page.
Jen, I appreciate you doing it. I've done a lot of preparatory work for this, and this is probably one of the best articles that I've read, studies on body function with arms. Control and function of arm swing in human walking and running by Herman Pontzer et al., Journal of Experimental Biology, 2009. Supports the postulate that the trunk and shoulders act primarily as elastic linkages. Again, elasticity. Your arms make your body elastic. Just keep that in mind for the whole discussion this evening. If you didn't have them, you would be more static. You would be more erect, firm, tight, solid. You get it. You would be less movable. Those arms also act as a passive mass damper system. It dampers compressive forces. It dampers load. It dampers excitement, which reduces torque on the head and the neck. So without that dampness or that damping activity, that damper activity, our neck and our head takes that jolt without becoming elastic. So our elasticity for our fascial components of our body, our soft tissue, all is going to be put at less, less stress on all that if we keep our arms moving. So keep that in mind. Love this study. The last webinar in this series will focus on the value of arm swing for reducing the ventilatory demands on your body and you during strenuous exercise as we stay elastic. Actively moving your arms is not only an essential part of active walking, it is also an essential part of active arterialization. For you to exchange gas, arms have to move. Otherwise, the gas you're exchanging is very small and it's very unhealthy. It's not good gas. You're not getting enough gas in and out for the first thing. And the gas that you are moving around your body is unclean. It's not clear. It's been moving around in your system, maybe a little too long. Keep that in mind. Also, passive movement of your arms improves your ventilatory elasticity, as we talked about a few slides ago. Another study, this is a study that looked at the improvement of pulmonary function with arm swing exercise in patients with type 2 diabetes in the Journal of Physical Therapy Science 2015, demonstrated how arm swing exercise improves pulmonary function via improvement of hyperglycemia, antioxidant activity, and fat metabolic activity. If you recall, in week 1 of this webinar series, I stated that changes in posture secondary to position of ease and comfort or habitual patterning changes perfusion and ventilation position and patterns of arterialization. So if we go back to week 1, posture has an impact on how we ventilate and how we perfuse. And posture, when it comes to ventilation, is not going to be a static posture of activity. It's going to include all 4 extremities. Tonight, we're going to talk mainly about the arms under dynamic load. There probably is nothing that repositions nor recenters patterns of ventilation and perfusion better than our 2 arms. And I said our 2 arms. We can't move our arms and perfuse if they're working together. You have 2 of them. Those 2 arms were made to work not together. They were made to work apart from each other. So you'll breathe better. You'll breathe better from the fact that you'll ventilate better. You'll have better mechanical ventilatory activity, and you'll perfuse better. Dead space that we talked about in earlier webinars, if one arm is moving in contralateral directions of the other arm at all times. So just the fact that the arms are these pendulums that do not work together makes us the primate that we are with the ventilatory system that we own. Keep that in mind. Your arms are your lungs. You have a lung under your right arm and you have a lung under your left arm. And those 2 lungs depend on separate activity from the 2 appendages that torque them, twist them, wring them, and get them to expand and contract like they should during any type of breathing processes you're in. And that would include standing and dynamic activity where you move forward. So arms that swing off each other increase lateralization of the rib cage. We talked about that in this webinar series. Abdominals, intercostals, and therefore improves the arterialization at the distal arterioles of your lungs. And that's where it happens. That's the room where it's happening. It's happening in that distal arterial area of your lungs. The areas where you're the furthest away from your bronchioles. That has to have those intercostals moving and pushing pleura around them. It's got to be shook and shaken up. And with one event going on one side, there's got to be something going on the other side in the opposite direction. Otherwise, nothing's being shooken up. Nothing's being shaken up. It's static. So the more that movement you have going on, that's unpredictable, perturbated activity. I always have said, keep my pulmonary system perturbated. Because if you keep my pulmonary system perturbated, no matter what conditions I am, under what stresses I am, under what loads I am, I'm going to be able to breathe because my breathing is going to be efficient and effective. So the more I can keep my pulmonary system at that distal arterial area of my lungs moving in directions that are opposite to my neighbor, the better off I'm going to perfuse and the better off I'm going to feel. You want to take anxiety down, this is a slide that'll do it. Start moving your arms. If you start swinging your arms, which we're going to show you some pictures tonight, you're going to start moving from side to side. You cannot swing your arms, Jan, if you don't move from side to side. It would be impossible to swing your arms and not fall over if the mass wasn't moving side to side during the swing. You were built for that. You were built for bi-armism, not bipedalism. Our arms moved before our legs did. We had to reach up and touch things. We moved our arms way before you had to use for your legs. Your brain is connected to that arm movement, which is connected to your arterioles. Argumentatively, our best personal trainer are your 2 arms, and you got 2 of them. You got 2 trainers. Argumentatively, I would argue with anybody, your best personal trainer, if you put your system to work with these two trainers working together on how to keep the arms apart, separate from each other, working in different directions, you've got the best training going on in your system. We want our lungs, especially our lower lungs, to change positions, wiring and ringing and unringing. Wringing everything out, unringing, taking wash rags, twisting them. And the wiring that goes with that ringing is all healthy then. It's all good because your satisfaction of what you're getting from every breath decreases your sympathetic system's need for overstabilization. The movement is not necessarily a shoulder function. I always get a little concerned, Jen, when I hear people talk about arms as shoulders. Arms are not shoulders, period. I said it. Shoulders are not arms. I would invite everybody out there to write that down and think about that. Arms are completely separate from shoulders. Arms do not require shoulders. Arms require ribs. Arms require thoracic rib cages, as you're going to find out. Now, the shoulder lays right between the shoulder joint, called your scapula, lays right between the arm and the rib cage. And so your shoulder is made up of the arm and the shoulder blade, but your shoulder is not your arm. You can move your arm without moving a shoulder blade. You can tighten up your back, extend your back, take away your thoracic flexion, and you can melt the shoulder blade, weld it right to your rib cage and not even move it. And now your arm will just move in its haphazard way, but now it's going to move in a haphazard way the same way the other arm does because you're too static. Now they're moving together at the same time. And once that starts to happen, you're moving your body forward in space, forward on the floor with too much extension and not enough thoracic flexion. Now you get done with the race of too much extension, you get to the finish line, you bend over, you put your hands on your legs, and you start your Hoover sign breathing again. Just doesn't make sense. Just doesn't make sense to me. So this movement is not necessarily a shoulder function. It is a thoracic function. It is produced by both shoulders and mid to upper thoracic reciprocal function and accompanying rib cage alternating lateralization, which is just what I expounded on. Important slide. In normal breathing, alveolar pressure must be less than atmospheric pressure. We talked about that in week 1. Go back and look at it. That is arm swing. This is arm swing. And greater the atmospheric pressure as the chest recoils during exhalation. Without that activity, your arm is not free to move. You will use your arm to hold yourself steady to handle pressure and posture. You become more static. The most common site of limitation is the right anterior apical lobe and the left posterior base lobe. The most common site of limitation of arm movement or swing is at the mid-lateral chest wall. The most common site of limitation of arm movement or swing has nothing to do with your shoulder. It has to do with the mid-lateral chest wall. Because if the mid-lateral chest wall, T6 down to T10 or T10 up to T6, which has T8 right there, the dome of your diaphragm, if that's too static and it's not moving, your arms can't swing. All you're doing with those arms is adjusting your body so you can't fall. But the arms are no longer a part of your movement process of moving forward. They're not a part of your ventilatory system of moving forward. They're statically tied to you. They're no longer free to move on each other, and they're no longer free to move back and forth as a pendulum with respect to the other side. The bipedal arm swing respiratory considerations I've listed out for you, I believe there's 10 of them. We'll take each one of them. Number 1, they're not in any order of preference. I wrote these, I got my pen out, and I just started writing. Number 1, arm swing counters twisting motion on the mid to low thorax created by the legs. Our leg sets the position we're putting our thorax in. Our arm swing counters that twist motion for efficient ventilation and forward movement that takes you straight ahead in time, straight ahead. If you didn't have a leg that was offset by an arm, your body would go to one direction. one direction or the other. We know humans like to go to the right. We know that because they like their arms next to their right side. We know that the chest likes the arm to the right side. We know a lot about how humans then have to compensate to get back to the midline. We know a lot about that. The thing that's really compensating is the low to mid thorax. The low to mid thorax is the pleural cavity, the intercostals, the abdominals, and how about this? The arterioles themselves, the arteries, and the pressure that's created down below in that area. That static activity is actually formed by the outward shells. That's what's called outward shells of layers on top of that lung tissue. We went over that last week. Number 2, uneven arm swing results in over-rotation of the trunk, resulting in wasted energy and inefficient overuse of the upper torso. Now your upper torso is involved. Your upper thorax is involved. And inefficient arterialization from the lower lobes of the static lung tissue. I just got through telling you, talking about that. Lungs that don't move become very static. They become less elastic, less pliable, less expandable. So when that happens, your upper thorax takes over because now your mid-thorax is no longer twisting and turning. Now the upper thorax has got to play games. And that would be anywhere from T4 up to C4. And you get this activity going on in the upper part, which is accessory respiratory function, accessory mobilization. It's because of that, because of the unevenness of the arm swing itself. If we could just get our arms to start swinging with respect to the other arm, the neck probably wouldn't be that big of an issue. Sometimes arms can't pull the neck out of it. We know that. But for the most part, this preventative program exists for all of you. It's called the 2-arm program, the 2-arm exercise program. I'm going to show you some pictures, some videos of that tonight. Number 3, arm swings should be rhythmic and similar to a pendulum, providing a source of pumping air in and pumping air out of the lung and around the bronchioles. That's what arms do. They were really part of this webinar series day 1. Your legs aren't, your jaw isn't, your ribs kind of are, but your arms really are working together with the ribs one-to-one. It also keeps the smooth muscle around the bronchioles elastic. And how many times have we heard that word elastic tonight? It seems to be kind of hanging around. That's a major important thing to consider. Elasticity of the body is extremely important for you to understand with arms. Because if your arms aren't moving, no matter how much fascial release you do, the fascia itself doesn't have a choice but to stay static. So you want mid-chest rotation, mid-chest translation for the elasticity. And that comes from the things that touch it, your elbows, your humerus bone. We talked about it last week. You need to be aware of it. We talked about that last week. You need to sense it. Where is it? What is it doing? How does one arm feel next to that chest? And more importantly, how does one chest feel to that arm? Number 4, the angle of the lower arm and upper arm at the elbow should approximate 90 degrees and may increase slightly as they are swung straight back. That's normal. But keep that in mind. So the increase of angle at the elbow during take back allows for the opposite leg to complete its cycle of movement backwards. So my opposite leg can feel the floor longer if my opposite elbow knows how to move back and straighten out a little bit. That's a normal arm cycle. That's not a gait cycle. That's a normal arm cycle. That's a normal thorax cycle. Bipedal elbow angulation should decrease on forward movement from backward movement, angulation values, to prevent elevation of the shoulder complex from overuse of neck and back extensors. Now, if you don't keep, above 90 degrees down here, your arms have a tendency then to start to bend at the elbow, and your shoulders start to what? Come up. Just write that down. Acute angles of elbows mean shoulders elevate. It's that simple. And we want to try to keep those arms as, triceps, pull them back. And then you come forward, try not to over flex them or overextend them. And if you can maintain that 90 degrees or below that as you go back and come forward, you're probably going to have less angulation associated with this movement of the body going up and down. So elevation of the shoulder complex is not managed by the floor. Now, there isn't a biomechanist in the world that's going to tell you that. Elevation of the shoulder complex is managed by arm swing on chests that have to be what, Jen? In a state of what? Flexion. These elbow considerations should enhance hemi-rib alternation and move blood and gas around the arterioles themselves, decreasing the arterial smooth muscles vascular resistance and increasing your lung capillary flow. Powerful sentence. Elbows now. We're talking about an elbow, Jen. These elbow considerations enhance hemi-rib alternation. That's what we all want. And move blood and gas around arterioles that then therefore decrease the smooth muscles vascular resistance, increases your elasticity, and increases your lung capillary flow. Last week, I got home from this webinar, and before I pulled in my lane, there was a walker who walks by our lane every day, and I backed the car out of the lane, and I chased her down. I said, "Do you mind if I take a picture of you walking?" And I did, and she was great, and I was very grateful and taped her walking. And I'm going to show you that after this slide. This week, Jen runs into this lady, knows that I just took a picture of another lady in our neighborhood. Jen and I live 1 mile apart to the doorstep to doorstep. So there's a lot going on in our neighborhood, obviously. But you know what? Here's the truth. There's a lot going on in a lot of neighborhoods right now. People out there walking. And after this evening, I would love to have you put your ventilation glasses on, your perfusion glasses on, your arterialization glasses on, your Hoover signs glasses on, your dead space glasses on, your intercostal glasses on, all the glasses that we had over the last 8 weeks, and put them on and watch people move their elbows and shoulders. Jen, you want to tell us a little bit about this lady?
Sure. I mean, I just pulled in to the driveway to pick up my daughter from daycare and saw this and had to get my camera out because Ron had shown me the video he wanted to use, and this is pretty much the exact opposite. So we'll go ahead and show you this one first, and I'll replay it a couple times because it's real short.
And watch her back, okay? She's just shuffling along. There's no mid-thoracic rotation. Elbows never move forward. Elbows are always at 9 degrees or more bent. And all the rotation that she's getting is coming through her neck and above. In other words, she's getting it all through her upper trap. She's carrying her body with her upper body. That's not a breather. She's really literally running, holding her breath. There's no elasticity in that mid-back. There's nothing going on with intercostals, and there is no push and pull from the ground. She barely can get a full stride. She's on her toes. So that whole picture of watching her walk, it's very concerning because I don't know what that's called. I've gone to a lot of marathons. Jen, you've gone to a few with me. And I just look at these runners and walkers. I don't even know what we call this stuff. But supposedly she's out for a run, supposedly. And I'm just asking, be nice and think gentle thoughts here. Go back, and I'm going to ask you to think about all 8 weeks. And I'm not sure you understand that, but go back and look at all 8 weeks. Because everything we talked about the last 8 weeks, you're looking at right now when it comes to inefficiency. Her body is swelling up as we speak. The inflammation is high. She's not pushing anything out. She's a collector. She likes to collect molecules. She doesn't know how to produce carbon. Her exhaust is plugged up. That's what I see when I see a runner like this. Now, this next slide is a runner that was running by my lane the day a week ago about this time. This is Carly. So here she goes. She's walking there, and she's swinging her arm, and I try to catch up with her, and I said, "Can I please get a picture of what you normally do?" This is how she normally walks. Look at her arm swing. Now, that's the exact opposite of what you just saw. All of her rotation, and I'm sorry, I did everything I could to keep up with her. All of her rotation is coming from her thorax, her mid-thorax. And she's saying, have a great day. The thing is, the hips on her are not carrying her. There's really nothing carrying her. She's flowing. Her body's being pushed forward by the ground underneath of her, and her chest wall is pumping and pushing her with air. She is not lifting her body up. She's being pushed up with air that's moving in and out. She hasn't timed her inhalation, exhalation with every step. She doesn't have to, because there's a little bit that in every step. One side's going to be more in an inhalation state. The other one's going to be more in an exhalation state. She'll never collapse because each side is constantly going through a system that's always going to do what? Hold her up. Because she maintained thoracic what? Flexion. Her arms are literally swinging. And when they literally swing, the ground is going to go up and down. And if the ground goes up and down, she's never going to have to worry about moving her head forward to walk. Because as she's swinging her arms, the momentum is going to be forward constantly. Look at her, wonderfully swinging. Anyway, just loved it. Week ago today. Now, let me read the slide first. Jen, you want to get this turned around for me? Arm swing reduces negative intrathoracic pressure swings. Intrathoracic pressure should not be going up and down in your body. It should be a constant. We need, I think it was week 3, not sure, we need intrathoracic negative pressure. The last walker you saw was induced with it. She's moving with negative intrathoracic pressure. The first person we saw, Jen's neighbor, positive intrathoracic pressure. Which means the first person you saw, her vertical angle movement, her angular movement, her body was moving up, fell down. Moving up, fell down during forward locomotor movement. By maintaining wrist extension and not wrist pumping and ankle dorsiflexion necessary for forward locomotor movement, the walker I saw was using her wrist, which was week 7, and her dorsiflexors, which was week 7, to maximize that locomotor movement that was being maintained by what was called negative intrathoracic pressure. Go back and listen to week 7, please. Because week 7 will tell you if your body goes down because your angle, next slide, right, Jen?
Yeah, I have a screen share off so they can see this real quick. So if you want to explain this, and then I'll put the slide share.
You're about to see 2 slides. Here's someone who's got a tripod, and there's no person in this, and they're looking straight out. This is called vertical angulation. So they're looking straight out horizontally, but the vertical angulation of some degrees is up here in the air. If you stand somebody on the ground and you put that tripod there and you look straight out, their vertical angulation is going to be down. This vertical angulation is going to be up. If you stand here and when you look at somebody in their eyes, your vertical angulation will be up. But if you get on a surface that's higher than somebody you're standing in front of, the vertical angulation is going to be down. That vertical angulation is opposite of where your body is. So if your vertical angle is up, your body theoretically is going down. If your vertical angle is down, your body theoretically is feeling like it's going up. When you move your arms, you have different vertical angulation from each arm. Each arm will move your chest wall up and down to pump gas. So now if you go to the slide that we put in, did they have it in their reference material? The first slide is this vertical angle that I just showed you. That is looking with vertical angle that's going up. But what you don't have on the slide is you don't have the individual's feeling of going down. The sense of their body would be going down with an angle that's going up. Just like this slide says, the sense of this body doing the survey is a vertical angle that's going down, which means that body is sensing itself going what, Jen? Up. And every time you swing your arm up and down, your vertical angle of swing is not just a visual thing, it's an actual pendular angle swing that's actually felt posturally because of the gravitational forces on your body from the arm swing. So when the arm goes forward or when the arm goes back, you're getting a pump up and down. When it goes forward, you're going to go down. When it goes back, you're going to also go down. But by your side, you're going to be up. So what you're doing is you're offsetting this angle, this verticality, which is your main push and pumper of fluid. I'm going to go back to the slide. Now let's read the slide. Arm swing reduces negative interthoracic pressure and vertical angular movement, body moving up and body moving down during forward locomotor movement by maintaining wrist extension, not wrist pumping, wrist extension and ankle dorsiflexion for necessary forward locomotor movement. So when the wrist extends and your ankles dorsiflex, your vertical angulation is going to be enhanced. So if you're pumping with your arms and your arms are stiff, you're not going to have good enhancement of vertical angulation. And if you plantar flex versus dorsiflex, you're not going to have vertical angulation. So arm swing is married to week 7. Because without wrist extension and dorsiflexion, you can't swing your arms very well. You can't. You won't be going up and down with vertical angulation from your body. You will always be extended with no vertical angulation, like that first lady, that neighbor of Jan's, and you'll be walking down the sidewalk with a back that's over what? Extended, because you lost thoracic flexion. Thoracic flexion is maintained, not at the end of the race. It's maintained during the race if you keep your wrists open. Don't put a weight in your hand. A weight in your hand will make your back extend because the wrist is no longer extended and it's flexed. And the minute the wrist is flexed, you now don't have vertical angulation. You're straight. This is a big deal. Your rib cage was made and blessed by vertical angulation. Those long bones come out in front of you. They were meant to rotate and pump and push in a pendular way through the use of the arms that are on top of them. So, we get into this discussion about arm swing. It's just so important to understand that arms are more than just appendages. They're part of your system of movement that requires ventilatory activity. If you were a robot, you wouldn't need to swing your arms very well. But they even learned with robots, arms have to swing. Otherwise, you can't move forward without falling from one side to the other, which is another slide coming up. So vertical angulation in this particular week is pretty doggone important. It's how you move your body up and how you move your body down every time you take an arm swing. When my right arm and my left leg go forward, Jen, my body went down. Then I'm going to come up, and then I'm going to go down. And then I'm going to come up, and then I'm going to go down. And I know you can't see the whiteboard very well, but I'm going to go up, and I'm going to go down. I'm going to go down, and I'm going to go up. And you know what's really neat about this whiteboard? What you see on one side is exactly what's not occurring on the other side. That's what your arms do for you. And that is why we have them. Okay, let's go to number 6. Head and neck rotation. Head and neck rotation effort for torso and thoracic direction, head-on body reflexes or body-on-head reflexes, is reduced by the influence of arm swing on the upper thorax to the lower thorax rotation. Arm swing divides the upper thorax from the lower thorax. Anybody who does any type of activities in life, whether it's a PRI technique or some other technique, you have to remember that you have an upper and a lower thorax. That's a given. The arms make sure you have an upper and lower thorax. The arms make sure of it. And if the swinging stops on one arm, the other arm is now there to keep you in position for no arm swing. I'll say that again. If one arm stops moving, the other arm is there on your body to keep you in position for no arm swing, which means this arm doesn't want you to fall. If this arm doesn't swing, my left one doesn't swing, this purpose is now for your body not to fall. But it's not there for ventilatory activity, it's not there for rib cage, and it's definitely not going to reduce, it's definitely not going to help you understand that you got an upper thorax from what? A lower one. Arms are made to separate thoraxes. Not from left and right now, from up and down. I think it was the second week, we talked about zones of the lungs. Do you guys remember that? Zones of the lungs. And those zones have a little oblique fissure for what I'm talking about right now. An upper lung and a what, Jen? Lower lung. And those fissures were given to you so your arms could do what? Rotate them and swing with them. They were designed for that, to pump and push right around those fissures. The influence on the mid to low thorax, T8 and below, decreases accessory respiratory activity from T8 and above, including the neck. Wow. This influence on the mid to low thorax, T8 and below, decreases accessory respiratory need from T8 and above. Now look, if you got a neck patient, you're a neck patient and you've got some neck problems, the best advice I can give you right now is to do everything you can to swing your arms. I didn't say walk. I didn't say do activity swing your arms. I said just swing your arms. Just start swinging them. Most optimal arm swing for respiratory and postural balance is 0.8 meters per second. That's why I put the meter in there, Jen, because I knew I was going to say millisecond, and I still did. Meters per second, which is approximately or exactly 1.79 miles per hour. Researchers will tell you that if you move 1.5 to 2 miles per hour, you are optimizing optimal arm swing. Anything lower than that, anything higher than that will probably be not your optimal arm swing. So when I see people get on treadmills that really don't have to really work at arm swing because the belt's moving for them, they're really working dead space in their lung that will stay dead because they don't have enough arm swing. Passive arm swing has been shown to effectively act on the spinal column. This is a big slide. As a spring. Your shoulder blade was designed for spring activity, as was all vertebrae up and down your column of your spine. They're supposed to spring. You load, and they're going to naturally unload. All that fluid between each vertebrae are going to be pushing you back up. The pleural cavity with that air underneath of you is going to push those shoulder blades back up. Please take an I&I course if you haven't, because that's all it is. It's pressure. We were made to spring. We're walking on springs. And it's because of that arm swing. So passive arm swing is not a bad thing. I said, you know what? Tonight, don't even move. Just do some passive arm swing. Better yet, I'll show you some videos on how to do it. Passive arm swing is probably the best way to replenish the fluid in your spinal column. The fluid between your ribs and the fluid between the ribs and the pleural cavity, and the fluid between the pleural cavity, you get the picture, all the way through your body. The more active the elbow becomes, the more active the shoulders become, and the more stiff the spring becomes between the pelvis, shoulders, and arms, resulting in poor ventilatory perfusion. I'm gonna read it again, Jan. The more active the elbow becomes, these runners with those elbows so tight and so stiff, the more active the shoulders become. You wear them for earrings. The more stiff you become, the less spring you get, and the less ventilatory activity you have. You can't argue that ventilation is not tied with arm swing. When the inertia of movement, this one's a tough one, Jen, so if I don't get this right, you're going to help me. When the inertia of movement is decreased, in other words, my inertia, my movement forward is decreased. Arm swing is set in motion. Arm swing is set in motion. So whatever you were using there to get that inertia to be mindless, natural. It doesn't mean you're going to run 5-6 miles per hour. I'm talking under 2 miles per hour walking. And the inertia of that pendular activity is set. The motion is set. The arm swing motion is set. The inertia of the movement then is down. You don't have to work. The arms are moving you, and you don't even know it. You don't even have to work. That amplitude of the shoulder and the rib rotation increases. Now I get amplitude of shoulder and rib rotation, and that's exactly what I need for perfusion. My arterioles are going to be going, yes, and I'm not even getting short of breath. This is wonderful, provided you understand point number 9. I didn't say you had to do more. I need you to find that inertia of movement that's as low as it can be. So your arms are freely moving as easily as they can, and then set in that movement pattern, set in that motion. Then I know the amplitude of everything you got inside of you is going to resonate like you've never felt before. The vibration, the frequency is going to be so wonderful because you're not what? Locked up. That's elasticity. That's why 9 is such a big slide. This biomechanically allows the intercostals to expand and integrate intercostal intrinsic intelligence. Now you got this mode, you know what's good for you. The woman that you saw walking down my street a week ago, that was her intercostal intrinsic intelligence. I just gave a talk on that. And she's now walking with respiratory activity, and she's not even out of breath. Hardly even sweat. Because she found that zone, if you will. Number 10, arm swinging and associated body movement is therefore a self-tuning event, is a self-tuned and self-stabilizing phenomenon that reduces multi-segment, multi-muscle, and multi-system disassociation and enhances physiology and physical association through the rib cage and underlying respiratory function. So basically, you're better integrated. Not only are you better integrated, you're better intelligently integrated, physiologically and physically. I'm going to quickly go over this, if you can Google this, race walking. If we could just change the word to something else besides race walking, if we could walk the way race walkers do at a slower pace, you got it all. Because in race walking, there are 2 rules that got to govern the way you walk. Number 1, you have to, the first dictates that the athlete's back toe cannot leave the ground until the heel of the front foot has touched the ground. Violation of this rule is known as loss of contact. Man, Jen, I wish all humans would be subject to some penalty, some fine, if they lost contact with the ground. Because see, if you don't lose contact with the ground, you're never going to lose thoracic flexion. Write it down. Never, can never happen. You can never lose thoracic flexion if you stay on the ground with one of your feet at all times. Can't extend, can't do it, because it's called angle of what? You got to have that angle of activity. It's going to say up and down, up and down. So you don't lose contact with the ground if you really want to get good thoracic ventilatory activity. Now, we can't walk that way in life. You can't. But that's about the best way you can get yourself to perfuse with good arterialization is contact with the ground. The second rule requires that the supporting leg must straighten from the point of contact with the ground and remain straight until the body passes directly over it. So now if it remains straight, I move up one body, Jen, as the other one's what, Jen? Moving down. Man, this sounds like this beautiful push pump thing that we talked about earlier with angle, a vertical activity, vertical angle. It's the same thing, race walking, if we just slow it down. Athletes stay low to the ground by keeping their arms swinging low, close to their hips. I didn't make this up, I Googled it. Read it. That's arterialization. That's arm swing. Arm swings has to stay. If the arm swing comes up and the angle of the elbow gets higher, you're going to lose the ground. You're going to be disqualified. Sorry. Joy, next year, try again. Maybe come back. Let's give it a second shot. Keep practicing. You're getting close. It's really important for us to understand that we stay low to the ground when we use arms. And then if you look at this one, if one sees a race walker's shoulders rise, it's an indicator to the judge right away, you're out. It may be a sign that the athlete is losing contact with the ground. They're on that person like no other. Those shoulders are rising. They'll slow them down, tape it. Oh, sorry, you lost ground contact. You're out. This position of walking reinforces abdominal intercostals, interscapula, and subscapular alternation during alternation of zones of opposition. We talked about alternation of zones of opposition weeks 5 and 6, and zones of ventilation in week 1, and associated desired arterialization in week 2. Tonight, we're tying it all together. And you could not tie it all together if you did not look at those two arms. The chest intercostals cannot do it by themselves. Abdominals cannot do it by themselves. How you breathe, the speed you breathe, inhalation, exhalation cannot do by itself if you're a human person walking with arterialization issues. Qigong arm swing is something that I ran across a few years ago, and I didn't poo-poo it. It just fascinated me, that and Tai Chi. I'm going to show you some of the things that I think this evening are things that you should consider implementing in your life and those that you love, and then implement it even in our PRI world of techniques that incorporate stance-related activities or upright-related activities. So I'm going to show you a few. I have my favorites. I'm going to show you 2 or 3. They're only about a minute or so long. Jen's going to help me. I'll give you some other suggestions before we end this evening. So Jen, why don't we go and start that? Do I play it or are you going to play it? And I'm going to come over there because I can't see it. Okay. So this is a young man. We're going to give you a minute and 30 here of this one. It's called waist rotation with swinging arms. First form of Qigong. Qigong. Here we go. You stand there, he relaxes his body. He stands about feet width apart, shoulder width apart. Your feet shoulder width apart. He's facing straight forward. He lets his arms hang loose at the hips. He rotates his hip and waist, and he starts to swing his arms to the left and the right. As his arms swing, he pats the shoulder with one and pats the lower back with the other. Now he's getting sense. He's separated his upper half from his lower half. His arms are compressing his thorax as they wrap around. One arm's patting him on the back as the other arm's patting him on the front. It's like a cow with a tail hitting flies in the heat of summer. Constantly back and forth, shifting back and forth, swinging. Little AFIR on each side. Be aware of the sensation of the arms as they go back and forth. And if you listen to this guy, which I hope you do, that's exactly what they're going to tell you. Be aware of the rotation of the waist guiding the movement of your legs. It's not the other way around. The thorax is guiding the rotation of the legs. Can you write that down, Donna? The thorax is guiding the rotation of the legs. Be aware of how the rotation of waist guides the upper body. The midsection of his body is guiding the upper and lower lung cage. Be aware of the movement of the whole body. Sense it. Sense the compression. Let's go to the next one.
I had a quick question, Ron. It looks like he goes up on his toes here.
He should be on his feet, flat.
So he should be on his feet.
Yeah.
Okay. Because it looked like he's, but I can't tell. It's hard to tell.
He's on his feet. See him there? He's on his feet. He's not on his toes.
Good. All right.
I've looked at, I don't want to say 100 Z. I've looked at a lot of these videos. Okay, let's look at 5th form. Arm swing with bending knees. Now, I love this one. Let's first of all, arm swing, bending knees, thoracic, what everybody? Flexion. Here we go. Relax your body. Stay on the ground. Keep your feet there. Stand with your feet, shoulders width apart and parallel. On the ground. Arms hang loosely at your sides. Swing the arms forward and backwards naturally as he starts to bend the knees. And you don't have to worry about timing of this. Each time the hands pass by the knees, try to bend the knees gently. Boom, 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 boom. That's vertical angulation. All he's doing, he's going up and he's going down. He's not using his body. He's not using his body to extend and flex. His arms are always keeping his body into flexion. When the arms go by, he's in flexion. When the arms go ahead, he's in flexion. Because at midpoint of that movement, He's bending his knees, bending his knees, bending his knees. Shoulders are resting on thoraxes that are elastic. Look at his shoulders. They're bouncy. Be aware of the sensation of the knees bending continuously. Wrist extension there, dorsiflexion below. Wrist extension there, dorsiflexion below. Be aware of the movement of the whole body. I'm going to caution all of you, if you really study Tai Chi and Qigong, you'll understand the importance of wrists and ankles. I'm going to show you that in the next picture. So we'll stop there. I'm encouraging you to go back. You have these. Go to YouTube, pull them up and watch them. I'll show you one more. That was arm swing with bending movement. The last one I'm going to show you is called counter swing. And this is counter swing. This will take your brachial chain, your pelvis, and combine it into a beautiful rhythmic flow of oscillatory function, counter swing. Wrist extension, wrist extension. Each side, one side's going down, other side's going up. Shoulders never are raised by the traps. Shoulders are raised by intercostals. Intercostals. Lung expansion, intrathoracic negative pressure. Rib rotation. That's flow. That's Qigong flow. Now, this evening, that's called passive arm swing. You are not walking. We have people that are walking and they don't even know how to stop and do passive. They don't even, Donna, know they've got arms. Next time you run with somebody, ask them, how are your arms doing? And they'll say, are you crazy? They're doing fine. Do you even feel them? Do you even know where they're at? Is one further ahead of the other one? At any given time, which one do you feel the most? Become aware of the arms, because those are your intercostals. Those are the sides of your chest. Arms are the lateral parts of your body. They're the periphery of your body. Your legs are not the periphery of your body. Your legs are the center of your body. Qigong and Tai Chi will tell you, arms are the outside. They're the world, your world. We also included 3 other Qigong YouTube video recommendations. We don't have this much time, but I encourage you to listen to these people. This one I love. I've listened to him maybe 10 times now. I love the way he thinks. Benefits of Qigong, energy gates. He combines it with Tai Chi. Very wise man. This lady, I'm so inspired by her inspirational breathing. She opens chest walls and shoulders. She unleashes the spine and she improves flexibility with her program. Now, there are hundreds of these on YouTube. I'm picking the ones that I think are good for this COVID-19 series. These are things that anybody who has COVID who has this virus should be doing after they get out of the hospital. This is important stuff. This makes you more efficient. This gives you a reason to take a breath of air in. I get pretty animated about it because I love it. I also think it's important for all of us to understand the way we started this webinar series was we were looking at not only lung physiology, but we're looking at spirituality, physicality, and the biggest thing is sensuality. Sensuality. And this intercostal wall is the most central part of your body. These lateral ribs are the most central part of your body. They have to be experienced. They have to be sensed during expansion. I honestly, what's that? Oh, and same gal, chest and lungs opening exercise. We'll end with that one. Strongly encourage you to look at it for a webinar series. Strongly encourage you to look at that and think about tonight when you watch that. Jen and I, man, come over here, Jen. I want to thank you for the last 9 weeks. We hope that this information will help anyone and everyone who watched or will watch in the future, because we know a lot of people will be watching this in the future. Better understand the relationships between the lung and the chest function, postural respiration guidelines and techniques taught by this institute, and breathing mechanics during and after these times that we're in. And who knows, we'll probably be here for a long time. I hope we get a lot of mileage out of this. I want to hug her, thank her. We're so close to each other. We live with each other practically. And I want to thank her very much. She's the one that puts all this together for you. I enjoyed doing it. I hope she did as well. We're grateful for your attention. We're grateful for your presence.
Yes.
And
yeah, and thank
have a good
you
evening.
to those of you who showed up week after week, because to sit here and look at just a black screen and present this would not have worked. So thank you to, I mean, there's like 15 of you who we've definitely seen pretty much almost every week. So thank you very much for showing up, because it makes it easier to stand here in a quiet, empty building and see your faces and present to you. So thank you, and have a great evening, and enjoy the rest of your week.
Yeah. And share this with other people, folks. Share this series with other people. And again, encourage them, start with day one.